Welcome to this explainer. Today, we're looking at a truly fascinating collision of two medical fields that you probably never thought would cross paths: aesthetic medicine and men's sexual health. We're going to unpack a surprisingly simple procedure that is quietly but fundamentally revolutionizing male vitality. Okay, let's dive into this. Can the world's most famous anti-wrinkle drug actually cure erectile dysfunction? Now, at first glance, I know it sounds like science fiction or maybe just some bizarre internet rumor you'd scroll past. But as we're about to explore through the research and clinical data from leading medical spas and urology centers, the answer is a resounding, scientifically backed yes. Section 1. The Wrinkle Reducer Revelation. From Foreheads to Frontier Medicine. So to understand how we got here, we've really got to look at how Botox works. It's globally famous for one specific mechanism. It relaxes muscles. By preventing muscle contraction, it smooths out those deep forehead wrinkles. But, medical science didn't just stop at the face. Doctors realized that if this neurotoxin can relax a facial muscle, well, it can relax other muscles too. Today, this exact same principle is being used to treat intense tension headaches, severe shoulder tightness, and now, with a somewhat ironic twist of science, giving us the clever nickname Bocox, it's being successfully applied directly to penile health. Section 2. The Limits of the Pill. When traditional treatments stop working. Now, what's really interesting about this is why the new treatment is gaining so much traction. You just have to look at the stark contrast between oral medications and this new injectable approach. Traditional ED pills, like the famous little blue pill, are systemic. That means when you take them, the medication travels through your entire bloodstream, which is exactly why they often come with systemic side effects like headaches, facial flushing, or even changes in vision. Plus, they can actually lose their efficacy over time. In contrast, Bocox is a highly localized, minimally invasive treatment. It directly targets the smooth muscle where the issue is actually occurring without affecting the rest of your body's systems. Listen to what Dr. Stuart Diamond at the Center for Advanced Urology notes about this. He points out that for patients who have relied on Viagra or Cialis, over time, a lot of these medications simply stop working. And man, that is a devastating realization for a patient. But this is exactly where Boco steps in to offer some profound clinical hope when those traditional pathways begin to fail. Section 3. The Science of Smooth Muscle. How Botox actually works. All right, this is where the biological aha moment really hits. First, let's break down the anatomy. The corpora cavernosa are the two sponge-like structures inside the penis that are entirely responsible for filling with blood to create an erection. The absolute crucial detail here is that the lining of these structures is made up of smooth muscle tissue. Erection quality is completely, actually, let's say 100% dependent on blood flowing freely into this specific tissue. When that smooth muscle is too tense or constricted, blood simply can't get in. Let's move on and see how this builds in practice. Step 1. The neurotoxin is injected precisely into the corpora cavernosa. Step 2. Just like it does in a tight shoulder, the neurotoxin causes those smooth muscles to temporarily relax. Step 3. Because the muscles are relaxed, the arteries are no longer constricted, which allows them to widen. And finally, Step 4. With wider arteries and relaxed muscle tissue, blood flow dramatically increases. Dr. Diamond gives us this brilliantly accessible analogy for this. He explains that just as Botox in the forehead prevents the muscle from contracting, we can do the exact similar concept in the penis. It works on that smooth muscle and literally allows the corporal bodies to fill with blood. It is the exact same biological mechanism. We're just applying it to a completely different part of the human anatomy to solve a very specific functional problem. Section 4. Inside the Bocox procedure. Quick, minimally invasive, effective. So, what does the patient actually experience when they walk into a clinic for this? 15. That's the number of minutes this procedure typically takes in the office. It ranges from 15 to 30 minutes tops. It's performed using a microscopic tubular needle under local anesthesia, which makes it virtually painless for the patient. And perhaps the most appealing part? There is absolutely zero required recovery time. A patient can walk in, have the procedure done, and immediately go about their normal day. 50 to 100. This represents the typical number of units of neurotoxin injected into the corpus cavernosum. During a session, usually about 50 units on each side. Now, if you're wondering about toxicity, you can absolutely relax. To put that into perspective, this dosage is significantly less than what is often used for chronic migraine treatments, and it sits way below the threshold for toxicity in a typical male. It's highly targeted, it's highly measured, and it is clinically safe. And this brilliantly illustrates how modern clinics are now taking things a step further. They're layering cutting-edge therapies for maximum vitality. You'll often see Botox paired with PRP, known as platelet-rich plasma, or P-shots. Basically, this involves taking a small amount of the patient's own blood, concentrating the healing growth factors, and injecting it alongside the neurotoxin. So while the Botox relaxes the muscle to let blood in, the PRP is working to actively regenerate the tissues and blood vessels for long-term health. Pretty amazing, right? Okay, so what is the timeline for results? Let's set some proper expectations here. This isn't a magic overnight fix like popping a pill. At week 1, the tissue treatment and internal healing begin. Between weeks 2 and 6, the neurotoxin fully takes effect and the patient realizes the maximum blood flow and full results. On average, the results of a single Botox treatment will stick around for about 6 months, obviously depending a bit on how fast the individual's body metabolizes the neurotoxin. But overall, it's a highly sustainable approach. Section 5. A new era of vitality. The benefits beyond the science. So, the crucial point is bringing this science back to the human element. What does this actually mean for a person's holistic well-being? Yes, patients experience stronger, longer-lasting erections. But way beyond the purely functional, this treatment offers a massive boost in mental and emotional confidence. It's actually been shown to reduce occurrences of premature ejaculation by reducing nerve sensitivity. It can even enhance the resting, flaccid size of the penis due to the constant, improved baseline blood flow. And as we noted earlier, it achieves all of this with way fewer systemic side effects compared to daily or on-demand oral medications. So who is the ideal candidate for this? Well, it's guys who haven't responded well to traditional ED treatments. It's also perfect for men who have heart conditions or other medical restrictions that make taking Viagra or Cialis flat out dangerous. Or, frankly, it's for men who just want a more natural, long-lasting alternative to relying on medication in the bedroom. However, I absolutely have to stress this. This involves injecting a neurotoxin. You should only ever have this procedure performed by a highly trained, board-certified physician. Don't cut corners here. I want to leave you with a final provocative thought. We just watched a famous cosmetic wrinkle reducer completely transform male sexual wellness. As aesthetic medicine continues to cross over into functional wellness, what other everyday treatments might hold the hidden keys to transforming our health? It's a genuinely thrilling time in medical innovation. Thank you so much for joining me for this explainer, and stay curious.